Hi, I'm Jay Penn with Behavioral Health Intervention Center. Many people inquire about the DWI assessment process. I'm here to answer some of the most frequently asked questions. In North Carolina, in order to administer a DWI assessment, the agency must have an authorization code given by the state's DWI Services Department. Furthermore, the clinician must be classified as either a certified substance abuse counselor, CSAC, a licensed clinical addiction specialist, LCAS, or a licensed physician or psychologist certified by the American Society of Addiction Medicine, ASAM. The DWI process consists of 4 steps. First, I'll start by reviewing and obtaining your signature on the informed consent and notice of privacy documentation. Secondly, I'll administer a substance abuse screening. It consists of a standardized questionnaire pertaining to your alcohol and drug use history and patterns. Next, I'll conduct a clinical interview in order to gain information about your mental, physical, social, emotional, and occupational health. And lastly, I'll review all the information I've collected and I'll render a recommendation. In North Carolina, a recommendation of either education or treatment hours is required as a result of a DWI assessment. Yes, in North Carolina, the lowest recommendation level for a person completing a DWI assessment is Alcohol Drug Education Traffic School, ADETS for short. ADETS is a 16-hour education program that is completed over the course of a 5-day time period, and the fee for this course is state regulated at $160. This recommendation is offered to clients who are cited for their first DWI offense, have recorded a blood alcohol content level of 0.14 or lower, and do not have a substance use or abuse diagnosis. All mental health and substance abuse diagnoses come from the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM. For substance abuse-related diagnoses, the client will present 2 or more signs and symptoms that indicate that alcohol or drugs are causing problems in their life. For an active diagnosis, these signs and symptoms must be present within the past 12 months. Some of the signs and symptoms include spending a lot of time drinking or getting over effects of alcohol or drugs, having gotten into situations as a result of drinking that have increased your chances of injury, or been in situations where you ended up drinking more or longer than you intended. Unfortunately, the straight answer is yes. There are certain rules that apply to all clients cited for a DWI in the state of North Carolina. No matter how long ago you were charged, if you've ever had a blood alcohol reading of 0.15 or higher, if you ever refused to give a blood alcohol reading, or if you ever had a prior DWI conviction, a minimum recommendation of 20 hours of outpatient substance abuse treatment is required. Your education and treatment recommendations are decided using the American Society of Addiction Medicine Treatment Placement Criteria, ASAM. ASAM patient placement criteria utilizes a score factored by 6 dimensions that include 1. Acute intoxication and withdrawal potential, 2. Biomedical conditions and complications, 3. Emotional, behavioral, and cognitive conditions and complications, 4. Readiness to change, 5. Relapse, continued use, or continued problem potential, and 6. Recovery, living environment. ASAM treatment levels are either education, outpatient treatment, intensive outpatient treatment, inpatient treatment, or hospitalization. If you've not gone to your final court date and there is yet to be a guilty or not guilty verdict rendered, you are in the pre-trial state. If this is the case, then you will be given an assessment report to take to your attorney or the court, illustrating you had an assessment done. This report is valid for 6 months and will expire if you have not started or completed your recommendation of education or treatment. If you start or complete the recommendation during this pretrial period, the assessment will not expire. It's extremely important that if you are convicted, you alert the DWI Assessment Agency of that conviction date, so proof of your assessment and recommendation completion can be sent to the North Carolina DMV. If you have further questions about if you should or should not complete the recommendation prior to your final court date, consult with your attorney. Remember that if you lose your case or plead guilty, then you will be required to complete the recommended treatment or education. Failure to do so prior to your assessment expiration date will result in you having to pay for another assessment. If you've already been convicted of a North Carolina DWI, you're in the post-trial state. In the post-trial state, you'll be eligible to regain full driving privileges. This happens once you have paid all fines, completed your suspension period, and an E-508 form has been sent to the DMV. The E-508 is an electronic form sent by the DWI Assessment Facility confirming you have successfully completed your assessment and recommendation. This form can take 5 business days or longer to be received by the DMV after you've successfully completed your recommendation. I'll need a copy of your DWI citation, a copy of your North Carolina driving record, and driving records from all states you have been licensed in. If you have an attorney, they usually have these forms on file and they can email or fax them to the assessment office. If you didn't give your citation to your attorney or you've lost the citation, it can be accessed from the clerk of court's office in the county in which you were cited. The blood alcohol amount is usually written on the citation, or you may have a separate paper with that information. If you refuse the blood alcohol test, then the refusal box may be checked. In some cases, such as a motor vehicle accident, a blood sample may have been tested and we will use those results to confirm your alcohol level.